so is Olivia, not to be a party pooper, but just looking at the pictures.
I don't know why.
They're struggling, aren't they, for some reason to, yeah.
It could.
Jazz has got her camera on and we still can't see her, so.
Yeah. As long as we can hear them.
This is true.
Now,
She's speaking to our item, that's really.
We're now live. We're now live, everybody. Okay. Yep. So good evening, everyone. This meeting is a meeting of the Health and Wellbeing Board. It's also being streamed live on YouTube. So welcome to everyone who viewing on the YouTube channel of Newham Council. Any member of the board unable to join the meeting in person is able to join remotely. However, they will not be able to move or second a motion or vote. With regards to the meeting etiquette, please can I ask you to indicate if you wish to speak by raising your physical hand, and the chat function will not be monitored during the meeting. So I'm Councillor Neil Wilson and I'm the Vice Chair of this committee. I'm the LBN Cabinet Member for Health and Adult Social Care. I have received apologies for absence from the following members of the board: the Chair, Mayor Roxana Fiaz, Chair and Mayor of Newham; Councillor Sarah Ruiz, LBN Cabinet Member for Children's Services; Abby Vago, Newham Place Partnership Leader and the Newham Chief Executive; Simon Ashton, Chief Executive of Newham University Hospital; Dr. Rima Viade. Is that right? So that was that, Rima Viade, yes. Chief Clinical Director of Newham Health and Care Partnership; and Lorraine Sunza, the Interim Chief Executive of East London Foundation Trust. And we should have online. Would you like to introduce yourselves? Christine. Oh no, you're here, but do Christine anyway. I'll introduce you.
Christine Alsasser.
Claire, you're introducing an item later on. Can you just introduce yourself?
Yeah, hi everyone, Claire Gresham, Assistant Director of Public Health.
Thank you. Jasmine.
Hi everyone, I'm Jazz. I'm Health Watch Newham Manager.
Thank you. And Nat, Max. Oh.
But you're on mute if you're speaking.
Wax, Newham Primary Care Development Lead.
And then you've got Olivia.
Hi, I'm Liv Kinsey, part of PA Consulting, working with Newham Health and Care Partnership.
Thank you very much. Okay. Any other apologies? We've not had any. No. And I'll apologise now for Councillor Card. She's probably stuck in traffic. She did say she was coming. Declaration of interest. Are there any declarations of interest from members of the board? And the minutes. The board is asked to approve the correct minutes which we held on the 17th of January. They're to be found on pages 13 to 18 of the bundle. For members of the board physically present, may I see by a show of hands that they're agreed as a correct?
Has some amendments.
Oh, do you? Oh, Julie, right. Come on then. Let's have some amendments. It's always good to have to read the minutes.
At the risk of sounding a bit vain, I wasn't actually listed as present when I was actually here at the, so if that could be noted.
Right.
And the item on Health Watch Newham had been attributed to Julia Nicholson when in fact I was speaking item. If those two amendments could be made to the minutes, I don't have any other comments.
Thank you. Good point, sir. So with those amendments, can we now agree them as a correct record? Oh, great.
I think I might have been here as well.
You were there.
Yes. Thank you for remembering.
You were there.
In person or online.
No, you were here, I'm sure.
Yeah.
Can I just get your name?
Yes, sorry, Marie Truman.
Sorry, I'm assuming you're here.
No, okay. I got the Julie mixed up before.
Yeah. Yes, it was a bit of a ragged start, if I remember. So is that all right with those alterations, omissions, amendments, whatever? Is they okay, the minutes? Thanks very much. Okay, now we've got a verbal report in terms of the send update. This is a standard item, so I'm inviting Emma on her last ever day in Newham, and thank you for attending. Emma is interim Corporate Director of Children and Young People, and she takes up a new post in another part of Britain, which we won't mention, but she may, to inform the board if anything else needs to be considered and etc. on the SEND improvement update. Thanks, Emma.
Thank you. So I'm here in place of our Director of Education and Head of SEND, who usually present for update. So just to provide a summary in terms of the continued progress against our written statement of action, which colleagues will be aware was implemented in March 22. And the written statement of action provides a detailed breakdown of key activities and commitments. And I believe that the board is aware of that plan historically. And also a focus on the developments in respect of the new inspection framework around alternative provision and taking into account progress made against that therein. I won't go through all of the areas highlighted in the written statement of action because I'll take it as read that the board is aware of those and kind of the particular areas of focus. Just in terms of an update in respect to current EHCP timeliness, so we have a set time frame by which they need to be completed by, and as of February 24, which is the last sort of data cut, we are standing at 38% of EHCPs being completed within timeframes. This is an increase on January's kind of performance, but it is below the national average of 49.2%. What, in terms of explanations around that figure, there's been new recruits being brought into the team and the implementation of systems. So we are expecting that to lift as those new recruits get embedded and more familiar with the systems in terms of meeting those performance targets. The number of education and health and care and needs assessments continues to rise. So from the year 2022 to 23, there's been a 30% increase in requests made. And as of this year, there's been 136 requests. So in 2023, so 2022, there were 692 requests, 2023, 886. And in the 3 months to date of this year, there's been 136 already. So, so it's also acknowledged that there's kind of rising demand for the needs assessments that then will lead to prospectively lead to plans being made. So whilst we continue to focus on those needs, and it's important that they are completed within time frames, there is a continued focus on the importance of the quality of those assessments, and there continues to be multi-agency quality assurance audit meetings and assessments being completed, and those will be shared with future health and wellbeing boards, and the dates for those taking place are the 5th of March to the 5th of April, the 20th, or they have been taking place, so that's due to complete on Friday. A further audit from the 22nd of April to the 17th of May, and a further one from the 3rd of June to the 28th of June. So systematically reviewing progress in terms of the improvement in respect of quality. Just in terms of some key updates, and it's worth noting that the Education Scrutiny Committee also that would give more if people want kind of more specific detail. So we continue to work in respect of developing a joint commissioning strategy. There is work that is happening to develop improvements in respect of our short breaks offer. We, in February 2024, in conjunction with parents and carers and our parent forum, the local authority alongside health partners held a local offer live event, and this was co-produced with parents and carers, and was really positively received within the local community, and there are plans afoot to repeat that event. There continues to be work around transitions and post-16 planning, and really looking at preparation for adulthood, both in between specific agencies, so children's social care and adult social care, children's social care and health, but also looking at the wider offer linked to education and opportunities for children and young people as they move through to adulthood. Work continues to develop and improve the local offer, so the digital information that is accessible to parents and carers. There's been a continued focus on speech and language therapy offer and occupational therapy waiting times. And I'm pleased to report that in particular for occupational therapy, those waiting times have reduced as well. So that's it. Kind of sums up.
Right, thank you.
It's quite a lot of information, yeah, and colleague Marie Truman-Abel is here also, who can assist with questions that there might be.
I suppose I have to ask the one about funding, basically, Marie, and you know I'd probably ask, as we've written, as both a board and I think the Scrutiny Commission was also concerned about this. The funding for education, health, care plans, I've got that right, Emma, haven't I? EHCPs, everybody will talk about. It has been assisted by funding from transferring money to ELFT, the East London Foundation Trust, via the ICS mechanism. But how are we getting on with that?
So, as an update, so as we know, we secured 2 years funding for SEND services, which were primarily for speech language therapy, occupational therapy, autism, and some wider services, including contributions to the Parent Forum and Zendias. So that funding has technically ended as of the 31st of March, but we have a 6-month extension to that, because I think everybody's aware that our financial allocations and our operating plan have been incredibly delayed this year. We have now this week received the operating plan and from NHS England, and so the work has been going on in the background to look at what the financial settlement will look like. So we have that extension, but then that long-term sustainability is still in the development. And one of the things that we have done, which I'm not sure if we've discussed it in this forum, and may have done in January, it was probably intention at that point, is to have a really focused deep dive across North East London on SEND. Everybody is experiencing the same issues, and I think it was really helpful to hear about those increases in the education, health and care plan needs assessment. We've seen those in health, so actually that request for funding continuation with those increasing needs may need to be because we are seeing more and more. But it's been very well received across North East London. There is a really strong recognition of that, and also our children's safeguarding capacities. If we look at things like looked after children, nursing and medical services. So they are really high priority for the ICB in terms of funding. We haven't finalised that yet, and I think there will be more to do, but our executive management team have had reports that I've produced. we've really emphasised that increase in the levels of needs, referrals, which I think people found quite startling when we look back over sort of a 5-year period and going back further about the level of need and increase. That's reflected nationally, so that's really helpful. So we've still got to finalise it. So that funding is continuing as it stands today, but there is more work to do to hopefully get that landed and secured. And as I say, across North East London, not just Newham. Newham has the biggest ask, I will say that, but I think probably that's reflective of our level of need and the number of children that we have. So we can keep bringing updates, and I think it's really helpful to bring it to the next board as well. And I'm optimistic, but it's a very difficult financial situation for the ICB and the ICS at the same time. So,
thanks very much for that. And obviously it's work in progress, as you've only just had the budgetary
yes,
point from the National Health England. I've got it right. Yeah, Emma.
I think kind of key to addressing both those issues about provision and quality. But also looking at best value. So there has been investment in relation to provision for children with SEND. So the new Connaught Special School is continuing to expand, and there will be 105 places in the new academic year 25-26. So one of the keys to addressing costs is seeking to make provision as local as possible and as accessible as possible for parents and for children. We are asking for expressions of interest in terms of capital developments from other providers and schools in the local area in terms of seeking to ensure that children's needs are met as close as possible and within their local communities, because that's key to addressing those cost needs as well.
Yeah, because I mean, since I've been on this council, one of the major cost increases has been over special educational needs transport, for instance. But just last one from me, and then I promise I'll open it up. Just in terms of these 136 requests already for assessments in the 3 months, that is reflected nationally by more recognition of parents trying to access services around neurodivergent, as well as other increasing health diagnoses.
A number of kind of factors that are contributing to that increase in identified need, but that we are. I mean, the key is about helping early and making sure that that children are receiving the support that they need at the point that needs are identified, and not having to wait for an EHCP or having to petition for an EHCP for that support to be provided. So that's one of the areas of development that's been looked at nationally.
Which will be a theme coming through the meeting about more preventative work and acknowledging an identification at an early stage. Thank you. Any further questions on this update at the moment? Anybody online indicating?
I just sort of,
sorry, Jonathan.
Just wondered to a certain extent, is there any thought that kind of the additional investment is perhaps then releasing kind of further demand for assessments that wasn't even really kind of considered when we had like long access? So it's, we're seeing a lot more people applying and trying to get diagnosed, but it's, just kind of that unexpressed demand that just wasn't coming through at all before, when access was more difficult. I think, is that playing out at all?
I think we probably think it is from the health perspective. So if we give the example of the autism pathway, which we have over a number of years investment into, I think that there could have been a perception that the waiting list was so long that actually people may have not felt it was accessible, and maybe some families may have accessed the privately funded route. So with that awareness that we have a service and we have reduced our waiting times quite considerably, they're still long, but they're nowhere near where they were previously. We think that has had an impact. I think the other one, and the other sort of point to make, which I think is really interesting, again, on that prevention and early intervention, with the investment into occupational therapy services, which has been a sort of teams around the school, we've actually seen that when those therapists are based in the school and they're much more visible, and they're able to really interact really well with the school, they're able to have their very quick conversations. The need for referrals and that very lengthy process has actually been stemmed. The increase in referrals are still there, but not in comparison to some of the other services, because that sort of advice and information and those very quick, easy discussions are taking place, so that then the teacher or the teaching assistant can put into place those strategies. And that's seen as a really effective model. That's what we're hoping to replicate with speech and language therapy. That's a bigger and more complicated service with more joint funding. So I think once, which we have organised and I think finalised, with the caveat of the longevity of the NHS investment. So that's the same model. So again, I think we will see less of that lengthy referral, and hopefully that might turn into less education, health and care plans, because people will be able to access the support when they need it. It won't be based on you need this diagnosis or you need this plan. It will be available and a lower level as well, which I think is something that we've not had in Newham. So I think that's all my comments.
Yeah, that sounds like a good example of sort of early prevention, early intervention, then that's impacting on.
Exactly.
Yeah.
Okay. Anything else? Anybody? No, nobody indicate. Thanks very much, Emma, and welcome to your last ever board. But also thank you for all your work in Newham. Thank you, and all the best in the future. But you are staying, I hope, because we may be in core or something. If you know. So I gave it a nice bit. Then you've got to. Thank you very much. So it neatly segues in, because I know, Julie, you've done some work around parental involvement on special educational needs, but are you introducing the report, or is your colleague?
I'm going to just introduce it, but Jasmine, who is fine, will actually be talking to the report. So this is basic.
Sorry, but I didn't even say for anybody watching. We're now on item 5, which is the Health Watch update, which is another standing item. And may I ask, invite Julie Powell, who's the CEO of Health Watch Newham, to inform the board and with her colleague. Sorry, Julie, I didn't do the introduction.
Thank you, Chair. So good evening, everyone. So I'm Julie Powell, I'm Chief Executive. We've been commissioned by the London Borough of Newham to deliver the Health Watch contract, and for this meeting's report, I'd like to invite Jasmine Smith, who's our new head of Health Watch. She came into post just before Christmas, to actually introduce our work plan for 24-25. So with your agreement, everyone, just hand over to Jasmine. The report is set out in the report pack, so we haven't got a separate presentation for it.
Yeah, thanks very much. Thank you.
Hi, everybody.
Yeah.
I hope you can hear me okay.
Yeah.
As Julie said, you should all be able to kind of see the work plan in front of you, and it's just to kind of lay out what our focuses are going to be over the next kind of year coming, and kind of lays out the details of where that has come from. So we'll just kind of run you through briefly kind of where we want to be focusing, and kind of how we're going to be dividing up that time a little bit. So we're going to be taking on or looking to kind of do some work around personal care in hospitals. What we want that to kind of be divided into is looking at one section, which is going to be around oral hygiene for adults kind of in inpatients, which in the work plan in front of you has kind of stemmed from some kind of background research from the NHS, looking to kind of bring that across Newham. And then the other half of that is looking at kind of personal care. So this is kind of looking more specifically at kind of whether the quality of care being delivered across kind of NHS areas is kind of safe, effective, and is person-centered, and kind of looking at that patient experience. So we obviously, so we deal with our NHS advocacy service as well, which gives us a lot of feedback into the different NHS providers and what those experiences are. So that's been really helpful in kind of guiding this as well, to kind of look at forming some kind of idea of what we might expect to see, but we want to be able to bring that forward. And the hope is that we'll be able to kind of work to inform the Newham Health and Care Partnership about kind of areas that we can look to focus on to start improving that quality a little bit. Our second kind of focus over the following year is about access to primary care services. So this is obviously a big area for lots of kind of NHS services across London as well, not just Newham, but what we kind of know for Newham itself is that that is something that we're looking to kind of really promote and encourage people to kind of understand and make use of, but we also want to understand a little bit about where the gaps are. So one thing we particularly want to focus on is looking at improving that feedback loop a little bit with patients regarding kind of access to their GPs or their kind of what the plans are within their GP services in terms of improving those networks a little bit. So the hope then with the feedback that we gather from that as one of our focuses is that we again can work with, for example, the Newham Health Collaborative, which we're already doing some work with at the moment around the experience of GP services in the area. We want to be able to kind of push that little bit further and kind of look to inform them a little bit more, and as well as the NEL ICB commissioners to kind of help them with how we can develop some real impact changes for patients that are using those services. Our third focus for the year is about increasing, and again, this one, we've got kind of two cancer-related ones. One is around increasing cancer screening or awareness of cancer screening and treatment for people with learning disabilities. So obviously there's a lot of other work going on within learning disability areas at the moment, particularly for Newham. We're working on multiple projects at the moment, but we want to really understand why there is such kind of a gap in the uptake of that and what the awareness is around that. So this is particularly looking kind of around women as well. And that's again to be able to kind of use that understanding and that knowledge to inform the Health and Care Partnership. And the second kind of cancer aspect is about increasing awareness around prostate cancer screening for particularly Black men. So we know that this is a group that is significantly lower in terms of uptake. So we want to kind of understand again what the barriers are to that and how that can kind of be used to inform and hopefully kind of move or develop plans to kind of help increase that as well. Then we're going to be looking more at engaging with Newham's diverse communities. So we've got a couple of things going at the moment, but we really want to kind of hone in on those in the following year. So for example, we're looking to run a series of focus groups. We want to really kind of amp up our community listening ears project and our Young Health Watch project, and then really starting to push on those community engagement events. And what we're hoping with that is that we'll gather lots and lots of insight into kind of various bits and pieces, but on top of that we'll be able to kind of use that insight to really help our kind of partners and the community to kind of start structuring and developing those changes a little bit more around issues that are really kind of prominent and that our communities are feeling really passionate about. And we're hoping that that will also help us to kind of develop our plans either kind of later in the year or for the following year, because we want to be able to really show that we're taking that feedback on and that it is, again, kind of coming back to the community further down the line once we've kind of done the work, rather than just kind of taking it and then them feeling like, you know, they've been there before. So one of the other focuses is about addressing health and care inequalities. So obviously part of the Health Equity Board and the Diverse Communities Health and Wellbeing Forum. So what we want to be kind of able to do with this is act kind of more as a critical friend. So offering solutions using asset-based community development principles. And the hope again is that we'll be able to build up a lot of partnerships around this. This is obviously something that's kind of at the core of a lot of different projects and pieces of work that are going on across the board at the moment, not just with Health Watch. So we're hoping that that's kind of going to be at the core of a lot of these other pieces of work as well that we're looking to push through this following year. You've obviously all heard of the Wellbeing directory already, the Joy platform. And so what we're hoping to kind of support with there is to really build that awareness of that platform, and to kind of feed back into it a little bit and kind of hear from the community as well about the utilization of that platform and how or where it needs to kind of be adapted or that sort of thing to really suit what the community is in need of. And obviously this is kind of in its early phases at the moment in terms of the platform being put out there and people starting to use it, but we know it's already been quite successful. So we want to kind of better understand that use and see where we can kind of really push the platform to kind of, again, help with people kind of reaching the right services at the right time. Another one of our focuses is our enter and view program. So this is something that we've obviously been doing for a number of years now, but we want to kind of use our enter and view program to really support us in terms of understanding different facilities across the borough. So obviously not just going into care homes and stuff, but for example, one of the pieces of work that we've been interested in recently is pharmacy services. So we've really wanted to kind of focus some of the enter and views around that kind of facility as well. So we want to really kind of broaden that kind of information a little bit more and kind of access as many different kind of services as possible so that we can really push that forward a little bit more. Again, kind of working with the Newham Health and Care Partnership, we want to be able to explore some further kind of possible projects with them. So looking at what we've got currently in the process, we're bringing in or appointing a deaf outreach worker, which is going to be a really successful kind of post for us in terms of helping us push that engagement with communities, as well as kind of experiencing some or looking to kind of build community health services, and community-based mental health services is another one that we're looking at. And then one of the other things that we're getting involved in is the population growth program as well. So we're really hoping to kind of use that to continue building on those projects as well. Sorry, I've got a bit of a sore throat today. So we're going to be looking at accessible information standards. So this is a piece of work that Julie and I have been discussing around kind of health literacy in Newham. So we know that it's particularly low. And what we want to be able to look at doing is producing some information leaflets, which will kind of clearly display healthcare and community kind of information for our residents so that we can look to ensure that they are being informed and are able to then make decisions that are around their health and kind of care process, but in a way that they fully understand rather than kind of in a very complicated way that we sometimes see health information being delivered at the moment. And then we're going to be continuing our NHS complaints and advocacy service. So this is so far been really successful, and we've been able to kind of reach out to a significant amount of people over the last 12 months. So we're looking to kind of push that forward and continue with that, and really kind of hope to kind of reach those kind of 300, 450 cases a year in the way that we have been previously. So those are our kind of main focuses over the next year. It's obviously encompassing quite a lot of areas, but our team is growing as well, which is going to be really helpful for our kind of pushing on our engagement side as well.
Okay, thank you very much. Very thorough exposition, and very well done at devising such a good work programme for priority areas. Questions from anybody in the room, or any observations? Doesn't have to be a question necessarily. Yeah. Marie.
Echo your words, Chair, really comprehensive, and it's really helpful to see it all together actually.
Yeah.
And to understand how we can link different projects that might be aligned to that. I just had a question, whether you, Jasmine and Julie, thought it was worth reflecting somewhere the SEND Human Parents Forum support and also the Maternity Voices Partnership. I don't know whether they're a little bit outside of this particular work plan, but just to kind of show, I suppose, any further breadth of work that you're doing in Newham and on, with partners.
And thank you, Marie, because we had a conversation with Health Watch London about this, because we have to do an annual report. And so what we focused on was where we were doing all those levers, and where the impact of those levers of change have been things like the New and Parent Care Forum, the Maternity Voices piece, and there are a few other pieces that we do which sit outside of our Health Care Act responsibilities for Health Watch. But I think what we're going to be doing for our annual report is making reference to the work we're doing with the Parent Care Forum and with Maternity and Neonatal Voices programme. But it's technically outside the scope of this contract.
I thought it might be, but yeah.
Yeah, but thank you for raising it. And maybe on reflection, and I did think about, should I make a reference to those other pieces of work, but I'm happy to contribute to the discussions in future meetings where
perhaps, you know, as it's an update item from you, how, you know, progressing to the work plan and all the other piece of work that not necessarily covered by this particular contract. Jason.
Thanks, and thank you. Thanks, colleagues. This is really, really helpful and interesting to read. I'm kind of thinking about this prostate cancer one, which I think is really kind of interesting and challenging at the same time. I mean, it's interesting and important. So it's a clear equity issue. It's a clear area that we've talked about over the years around a range of things where national policy maybe doesn't intersect well for minority populations. So obviously we don't have a formal prostate cancer screening programme. But I'm also, and I was wondering whether Wax might come in on this. I was wondering if we've got a good idea of what good would look like in this area, and what our kind of what our benchmark of what we're kind of doing this work against is, because yeah, that's kind of what I'm kind of reflecting. I think it's a really important area. I think we should link it into the health equity programme. I think it's a great health equity piece of work. But the one question that I'm not sure on is, what do we really want? If this is working really well, what would it look like?
Yeah.
So if I could,
Julie, and then I'm going to ask Max if he's got.
So we did this piece of work in another London borough, and what we started with was a conversation with GPs. And one of the things that emerged was that many GPs didn't think to just ask Black men of either African or Asian heritage when they come into the surgery, oh, by the way, do you get up in the night to go to the loo? Or do you know, what have there been some changes? There were some simple questions that colleagues at the time were not asking, and they're really simple things. But what we did was we worked with the federation in that borough and ran a sort of training program. We worked with another specialist prostate cancer charity and did a small training program, which was really about encouraging practitioners to ask questions, and then if there is a concern, to actually do suggest some investigations. And what they were able to do through that program was actually were able to identify men who were precancerous, if you like. So that was actually, so there is a piece of work. So you're quite right, Jason. I think it's a joint piece of work that we could be doing across the system. So with the Federation, with public health, and obviously with the Health and Care Partnership. I think for us, you know, we did quite a lot of trawling around what information was available. And because prostate cancer is not part of the national screening programs, it means that it is often just not thought about. So this is really an example of, I think, Health Watch understanding the nuances of its communities, understanding the local partners, and being able to pull together a little bit of a piece of work. The other fun bit of work that we did alongside the work with general practices was we also managed to find a bit of money to actually commission a photographer to do some portraits of Black men. And basically, at the time, it was like 1 in 4 men of African heritage were testing positive for prostate cancer. So we had these beautiful images in the Civic Centre. And one of the cabinet members said to me, "So which of these men have got cancer?" And I said, "That's the point, councillor. We don't know." That's the silent element of it. And that's what we're trying to say. We've got to work at it differently. And it was a powerful program for us, and it was very impactful. And so we'd like to be able to, we may not be able to emulate it in quite the same way, but it just gives you an idea of where those ambitions of what does good look like.
Yeah. I mean, I think it's worth emphasising for the board that what the reason we don't have a national prostate cancer programme is because the screening test for cancer will identify a lot of cancer, a lot of which doesn't need treatment, but a lot of does need treatment, and it's very difficult to unpick that, and so the risks, the kind of risks of a large scale screening program around prostate cancer are thought that you will do a lot of very significant unnecessary treatment for people who wouldn't have needed it. The downside is obviously that you then don't screen people who would need the treatment.
Would it? Yeah.
Well, so I don't know, have you got any thoughts on this?
It just listening to the report, it just sounds like a fantastic opportunity to do some work in collaboration with patients, residents, etc. And prostate cancer is a really good example to work around. We know that we have huge inequalities in terms of outcomes around some of our cancer metrics. Breast cancer is another one. Screening age, again, Jason, as you know, I often see young females who present with breast cancer well below the age of screening. So, screening, we talk about it when people come of age, but absolutely, it's about having those conversations, making every contact count, and making that consistent offer across the whole of borough. The insights from this work, I think, will be really, really helpful, especially in that neighbourhood space as well, where we have our staff, etc., Linkworks, etc., who are doing some fantastic work in starting to have those conversations as well. So I see this as a fantastic opportunity in terms of what looks good. So we could have objective outcomes and we could have subjective outcomes as well. But where we absolutely need to be is that, I want to be opening my clinic page and people presenting with, doctor, I have these symptoms and I'm really worried about it. People engaging with the GP, us being able to provide access, lots of information being out there that people can call upon easily to access, and at that neighborhood level, not just at the billboard level or the national advert kind of situation, because we know and we've learned over the pandemic times how residents and patients use social media. So a real opportunity. I think we can make a real difference. We absolutely need to see much more of that kind of patient participation group, engaging with our patient residents, not just across a GP or a clinician's consulting desk or a reception window, but actually sit down and take the time to make a difference and listen and learn from what our population needs are. I just wanted to highlight another piece of Julie. We've done some work actually around the MMR vaccination just in the recent times. So Newham colleagues, Izzy, have been working with the NHS NEL comms team, and not your classic kind of promotion of MMR through leaflets and texts and picking up the phone and calling, but actually sitting down and having conversations with people and starting really to open up about the reasons why people are hesitant to undertake certain interventions, etc. So there is some good work happening, but I see this as a fantastic opportunity going forward to really improve the health and well-being of our residents.
Thanks very much for that, and thanks for the report. Anybody else? I have a few points, but I don't want to dominate this. Mumtaz?
About the
Sorry, can you project a bit, because that's it.
Deputy Cabinet Member for Health and Adult Social Care. My query was around the complaints and advocacy service. Do we know at what stage we give out complaint procedures, and how do we encourage those using service who are not satisfied to make a complaint?
So the NHS complaints advocacy contract is for any complaints for patients making complaints for hospital services they've been dissatisfied with in the previous 12 months. So what they do is they contact the advocacy service, who then investigate the queries. Sorry, I didn't quite hear what you were asking.
Okay, so it's once they've received a service, they automatically get a procedure.
Yeah, so what happens is our advocate will take down the details of the complaint and will investigate that complaint and advocate on their behalf with a view to reaching resolution. And then if it doesn't, it will get escalated up to eventually the Ombudsman if necessary.
And I was just wondering whether there's room for feedback. So it's not just necessarily that it's a complaint, but feedback of the service that they've received. I'm just wondering whether there's that scope.
So currently what we do is that we get Mind in Tower Hamlets and Newham as part of the performance monitoring. They give us case studies of patients that they've supported, and sometimes within that they'll offer the patients will offer commentary on how they found that service. But what we found is obviously people who are dissatisfied with services they've received from the NHS.
Okay, yeah. Mine was around, is that okay, Mumtaz? Right, yeah. Mine was around, just briefly on, it's been noted about Joy has been very successful in terms of the amount of interventions that, it's been receiving. But, it is a valid point, I think, where it says, directing people to local health and care services, which social prescribers who are known by a range of different titles. And I think we do need to look at, what the landscape is like from the residents' point of view. Young Health Watch, what age groups and what locations?
That is up to 25.
That is, particularly bearing in mind the SEND sort of cut-off points and things, yeah. And locations, do you go to them in schools, or is it, yeah? Schools and colleges, I hope.
Yeah, so we have a mixture of approaches that we use.
And my last one, it ties up with how we started the discussion around increasing awareness about cancer screening. I note that Newham carers have raised concerns about the access of breast cancer screening to women with learning difficulties. And I think that's another issue about how do we make certain, and there is reference there, of course, which I know Mumtaz and I have discussed with Roxana about particular concern among families reflecting racialized and minority communities, because it's about not just cultural issues, language issues, access issues, and so I think if that informed the health and care partnership and the findings, it would be very useful work, just like.
I think for us, what we're trying to do is broker a bit of a better understanding about what intersectionality looks like in Newham, because we have a population that reflects the global majority. So actually, it's more likely that different identities will interact in those ways. So it's really about, Newham's been so, I think, brave in terms of tackling the health inequality thistle, and it's really about contributing to that conversation, and sort of the work the Health and Care Partnership are doing around population growth has been really, really interesting, and the prioritisation around health conditions has been really interesting, really interesting conversations about what are cross-cutting themes. And so it's really about, within 12 months as a small team, what is the nuanced insight that we can gather that can be helpful colleagues in terms of decision making and potentially commissioning opportunities, and dare I say, thinking about shaping some of the local provider landscape as well to be more responsive, because I think that's part of what this is about.
And did I hear correctly from Jasmine that there's been some increase in the number of people you have? Or was I being optimistic there? Was there some increase?
Say that I think referring very kindly to the to that deaf outreach work that Health and Care Partnership are going to be locating within us.
Right, because that's another concern. I mean, both Roxana and I were quite rightly, we're talking about visual impairment at one level where at one group. Another time we were at something else where in consideration of aging well, it was about hearing impairment groups. So the more we consult with our residents, the more that people with multiple issues, as well as multiple sometimes long-term conditions, but also their disabilities. So thanks very much for all that. Yeah. I think
really good piece of work.
Exactly, and we'll look forward, because you're a standing item. So thanks very much, both Jasmine and Julie, on that one. Now we have at this point the recommendation on page 20 to note that report. Is that correct, Christine? I have to ask that formally. Should we note that report, colleagues? Thanks very much. Thank you, and thanks obviously for the hard work, and the work continue as it were. It's never going to get less. I don't think it won't. It's only going to get in one direction. Now we've had reference to population growth. We have a population growth report there in terms of item 6. Item 6 is the integrated care system strategic approaches to meeting Newham's population need, and I'm going to invite Marie to introduce that, please.
Thank you. Joe and Ryan, who aren't available this evening, are our leads, and this is a piece of work that we have an organisation called PA Consulting, who are doing probably at least 95% of the work, and that's Olivia Kinsey, who we have on the call this evening, has very kindly joined us. So I'm very happy to give a bit of an overview. I won't necessarily talk to the slides, but give a bit of an overview of the programme. And then if there are detailed questions that maybe I may struggle slightly to answer, I may live in to answer them, but I will do my very best. So the Newham Population Growth Programme. So to give a bit of a background and the rationale, so the Newham Health and Care Partnership has been understandably concerned by the projected level of population growth that Newham is forecast to experience. I think we're looking at something around, I think I want to say about 30% over the next 20 years, but that does sound right from memory. I think I would know it's about 5 pounds back of my hand. And in terms of that population growth in itself is not of a concern, but it's how we respond collectively as partners to be able to meet the needs of the population in Newham, and also the nuanced needs of our population. And so understandably concerned about what that looks like and how we effectively respond, and how we can expedite some of our understanding and then developing some responses to that quickly, so we are ahead of the game and can start putting some of those plans into progress. And I think it's really worth saying that the as is, as we have now, is not likely to be affordable. I think we could anticipate that if we proceeded as is, we would need a second hospital in Newham. Now, whether that's going to be something that is feasible and desirable from a national perspective, it would be up for debate. So I think the focus is going to be on how we respond to the partnership, and both as a prevention and early intervention approach. And so that might be how we use money differently to really kind of focus things more downstream. So we've talked a lot about today about cancer screening. That would be a really good example of that, and how we could advocate for that more. And I think the other element that the partnership has really strongly advocated for is that making sure that Newham gets its fair share of the allocation of funding, whether that's local authority, whether that's NHS, etc., etc. So making sure that we are advocating strongly for the needs and our population in Newham, which I think we all do, but we do, I think, have some understanding about that perhaps we haven't secured as much as we might have done, but there are opportunities to be able to do that more effectively, some of which we've talked about here before. So the what, as I say, we commissioned PA Consulting to do this piece of work. We went through a competitive procurement exercise, and the scope of the piece of work was developed by partners, and that expression of interest in interviews with those interested parties was done on a partnership basis. So they presented to us based on the scope that we developed. And what PA, who were successful, will be producing is a really clear data set. So we've got a very clear version of the truth as to what we think the population growth looks like, both in terms of demographics, but also increases in different areas of needs. That might be a long-term condition. That might be specifics around the needs for older people versus babies and children. And we'll also have a range of interventions that we could approach to look at some of those highest levels of need, those highest areas of growing needs, that we will have some, real impact on if we change the way we both deliver services, but also how we use money for services. So it might be that we move out of our hospital and put it more in a primary care and community. That can be quite a controversial topic, I think, in Newham. I think everybody is up for that discussion, which is really, really positive. And just to outline some of those areas which have emerged as real opportunity areas for us to focus on going forward, where we think there's going to be some of that really high level of growth of need. So we really need to focus our gaze. So that would be things around CVD and chronic heart disease, respiratory, so including things like COPD and asthma, frailty and dementia, which everybody would expect as we expect to see a growth in our older population, diabetes, which I don't imagine comes as any surprise, and also our focus on learning disability and autism and how that interacts with physical health. So we just, again, talked about that with regards to cancer screening and people with learning disability or autism. And I think alongside that is how we've taken all age approach to it. So not just focusing, again, on what we do when somebody might be getting nearer to the age where these sorts of needs emerge, which we know is also younger in Newham, or have already experienced that or been diagnosed, but actually what can we be doing at a very early stage, whether that's in maternity, whether that's in childhood. So there's really that focus in it. And also how we can utilise this and whether any of it would be applicable to delivering on a more of a neighbourhood approach. Now, I think we're all aware that, that's a very early stage in those discussions, but would that work well? Would that be how our residents would like services to be delivered? There's a lot of scope and opportunity there, so neighbourhoods and obviously primary care networks. So this work is a 3-month piece of work that is sort of technically concluding at the end of March, but obviously Olivia and the team who are presenting and finalising some of that information. Having seen some of the real detail today, it's looking incredibly impressive. What will then be the opportunity is to have a roundtable event with all of our local stakeholders. We want to make that really broad, so we're particularly getting frontline staff who will be involved with delivery in these changes. And that's likely to be, I think, in May. And then we'll have work programmes that the Newham Health and Care Partnership can take forward. And I think a real key thing is how we will take this out into Newham. And that would be something to, for us to think about, Julie and Jasmine, how we actually take this out, and does this make sense? And actually, how would that be delivered, and does that resonate with people? Does the focus on a certain area resonate? And again, how would that actually work in practice for residents? And the last thing I was going to say is that it's been a very much a partnership piece of work to develop. I think Abby has particularly noted that there is a kind of aligned piece of work that the local authority are doing around looking at population growth and what that means. So that might be wider than health and social care, for example, housing. And that's coming to our Newham Health and Care Partnership on Friday. So along with an update on population growth, we've got that update. So that feels really partnership and really, really positive to be able to sort of join all of the dots, because something like housing is obviously a huge and massive issue, and also the impact on health. I will leave it there. Hope that was a good whistle stop tour, and I've done the work justice, probably not. And hand back to you there.
Right, thank you. Can I just, on page 35, the data-driven priority areas don't come as a surprise to me in terms of diabetes, respiratory, which asthma through to COPD, cardiovascular, coronary heart disease. The very important one we've already discussed in terms of learning disabilities and physical access and frailty and dementia, because we're growing as with our aging well strategy. But the neighbourhood teams, there was also just a little bit of problem about accessibility when you're talking about things like, I think I know what JPGs and HCPs and QOF QOF, because of being a governor on health and things, but I just think it might be helpful if we just have a bit of a glossary on it. But the neighbourhood teams, I was just trying to work out GP, DN, CN, SA and HO. Are they, that's not geographical teams, HO is housing, I'm just assuming. You see where I'm looking?
Neighbourhood teams, so GP, yeah, district nurse, community nurse, SA. Oh. I'm trying to guess what that might stand for.
I think that was supposed to be substance abuse. It should have been substance misuse. Apologies.
Oh, substance misuse, was it?
Yeah.
Right. But obviously, we're trying to, whether it's, Roxana from the political direction of the mayor and myself as cabinet lead with Mumtaz, looking at how we're serving our populations at the most appropriate level. One of the important things that, and we've had this at the Integrated Care Partnership, what does subsidiarity really mean if there's a national framework which doesn't actually allow for that flexibility, that development and that innovation? So we have to go around some of the structures in order to get real neighbourhood sort of, because that's where it's not just about how we're going to integrate more and multi-agency co-location and all the rest of it, but sometimes the structure seems to get in the way of developing some of this. But my kickback is not so much about saying we might need another hospital. It's also about, we do need to stress every time we meet about inner London, outer London funding, about the historical funding base that as compared with other parts of the northeast London landscape. My outer London colleagues would say the same in their reports, as you know. So I just have to put that out there. Now, Jason needs to come in because I've said enough.
I've not got a question because I'm, thankfully I'm, lots of opportunity to be involved with this piece of work and have lots of chances to input. It's more a reflection for the board. So we've had we've established as a standing item this having an item on the kind of meeting the future needs of our population. and we're going to be talking a bit later about starting another conversation about our ambitions for the board and the role of the board. And I think this is really important in that, and thinking about what role we want to take as a health and wellbeing board in what's, we all know it's not a Newham thing, this is a national thing, a really struggling health and care system now, let alone where it's going to be in 10, 20 years, and really think about when this piece of work is finalised, having a really good think as a board about, what we want our role to be in the system. We've got the Health and Care Partnership Board, our place-based partnership, which is, got the responsibility for delivery and knitting this thing together. So what's our role? And it's particularly, I think, that point that that Marie made around advocacy, around holding the ambition for our place, being really ambitious for the place. So that's just, it's kind of a marker for us to return to this when the report's finalised in quite a deep way, and thinking about what we want our role to be.
Yeah, very good. Emma.
Chair, so just in terms of noting some of the more recent demographic changes post-pandemic, and linking that to funding formulas, because there is that differential between inner and outer. And actually, when you look at population, particularly in terms of children and families, there are some marked demographic shifts from inner to outer London that funding formulas have not caught up with. Particularly when we know that some of our inner London colleagues are at the point of considering closure of primary schools. But that is, kind of not being seen in that as populations are moving to more affordable areas. So that, I think, does need to be addressed at London level.
Jonathan.
Yeah, I think there's some very interesting population trends happening, because whilst you look at the number of children is clearly growing and forecast to continue growing, and our actual number of births is on a very slight downward trend. So I think kind of 2-3-year-olds, there's a big inward migration. So it's the impact of services complex, and obviously maternity on that in that case. Just kind of a question whether we've maybe sort of adequately considered mental health and well-being in this case. When we had a quick look at the trends in the numbers of conditions, it was like the common mental health conditions, anxiety, depression, which have actually increased far the most over the last 6 years, and that goes back well before COVID. It's not a recent couple of year trend, and I think it's quite clearly established that does really outstrip everything else over and above. The cardiovascular, diabetes, obviously that's a massive burden, 70-80% sort of thing of what the burden of disease, that's very much welcome there. But also dementia hasn't increased a great deal. So whilst I think a big impact and a lot more older people projected, but that is one area I was a little surprised actually that perhaps has increased less than over the last 6 years than we might have expected. So, but I think maybe we might just need to think about the impact of sort of some of the mental health conditions really. We did want to try and build on this and do a little bit more detailed work to really unpick the impact of more recent new build and population change over the last few years, and then how much health resource that's consumed in a probably long term, something a little bit more in depth than has been possible in this consultancy piece that might help kind of ongoing longer term. So that's sort of something we're trying to build. We're doing some data join up work between health and care.
There's a whole realm of issues that we could on a sort of complicated map, sort of put all about the, development of, shall we say, the Royal Docks, which is in some meetings are saying they have no access to this, they don't have access to that, and another 10,000 projection, and then the demand on Newham Hospital because of the riverside development in Barking and Dagenham, and the population increase is not bound by the River Lee or the River Roding or whatever it is. As Emma said, there's a whole load of movement out of families, and it's getting that sense of what Jason was saying, is that we know the system's under pressure, but this is a really increasing thing that we've got to just address and be quite strategic about, and to make certain that we've got that campaigning or that ability. I think I was trying to say that in terms of the company where I said it, that we shouldn't just be hung up on governance structures. It's about, what are the real needs and how we can identify that. Yeah. Sorry, I've been very rude. Didn't bring you in, Olivia. Did you have anything to contribute to this discussion? Sorry. You've been listening very patiently to us.
No, thank you so much. I just wanted to pick up on the mental health point, and absolutely, I think that's very clear in the data as well. We did kind of initially choose 5 priority areas to look at. Alongside those areas, we've also looked at kind of wider determinants of mental health and mental health alongside long-term conditions. And it's absolutely the intention that we've been working kind of really closely with the Health and Care Partnership team, that this work could be potentially kind of replicated for those cohorts in the future. And within the data that we're looking at as well, we have mental health data. So absolutely kind of does demonstrate that, but it's a very good point. Thank you.
Okay, thank you. And last word, Marie? There was nobody else. Sorry, there was nobody else on. Yes, Marie.
So I think, again, those points that have been raised, I think mental health, that has been a challenge back. I think as Liv has said, how that's embedded into some of the groups, so that the interaction between perhaps a long-term condition and the sort of common mental health conditions, I think will come through quite strongly. I think we've really been prompted by those housing developments. I think that was one of the things that really prompted that, particularly Barking. And as Liv has said, one of these secondary aims of this work is to be able to replicate it and share the learning across North East London, particularly with Barking, because they are having similar challenges and that similar growth, and that's already happened. So we're hoping that it won't be a sort of piece of work that we put on the shelf. It will be very sort of live, very strategic, as you say, and will guide us going forward. But it will be about us to take that forward and respond to those different areas of growth that we see, as Emma has talked about, and Jonathan, about the different dynamics that we're seeing with children. It's absolutely fascinating, but it's how we sort of respond and keep it iterative, isn't it?
Yeah.
Thanks very much. So that was an information item. Just so I love the way that we in local government speak. There's so much information. We'll continue to have an information item. But thanks very much, and thank you for joining us, Olivia, in this piece of work. Thank you.
Thank you so much. And
now another big piece of work is the 50 Steps 2.0, as we're calling it. This is the second. The second version, because it's a refresh, and I invite Claire, as the Assistant Director of Public Health, to introduce a report to be followed by any questions. Clearly, just as a segue from me, I introduced this paper to Cabinet in his very room yesterday, so it would be rather nice if somebody else did quite a lot of the talking on 50 Steps, because I think I did my bit yesterday. But thanks very much anyway. Claire, you're going to introduce for us. Thank you.
Yes. Hi, everybody. Can you see me on the screen?
Yes. You're the first we've seen on the screen, actually.
All right. Oh, that's good to know. Well, thank you very much. So today we're coming to seek the board's approval for the refreshed 50 Step strategy. And as you know, it's the Health and Wellbeing Board's strategy, which is why we're here asking for the board's final approval of the strategy. So the aim of the strategy is to improve health and reduce health inequalities in Newham. And we've been to the board a couple of times talking about our progress. and highlighting that we very much have built on all of the success and partnership working and learning from the past 3 years of developing the first 50 steps. So the new version is a result of 12 months of work, which has involved over 50 partner organisations and council teams. Many of people in this room and your teams have been involved, so thank you very much for all of the work and the contributions that's gone into it. We've also involved lots of residents, so we wanted to ensure in writing the new strategy that it speaks to Newham. It feels rooted in the strengths, diversity, assets of Newham as a place, but also the significant challenges that our population faces. And for that reason, we've gathered insights not only from our partners and our stakeholders and our colleagues, but from over 3,000 residents, to ensure we've heard from them about the things that matter most to local people, and that in delivering the strategy, we understand some of the nuances around what residents want to see, want to feel, what does and what doesn't work for them. And this engagement won't stop at the publication of the strategy. We'll continue involving residents in everything we do, and I'll talk a little bit later about our refreshed Changemakers programme, which is just one part of that. So we've also aligned the new strategy with the Newham place-based priorities and building a fairer Newham, both of which have come about in the past 3 years, so since the publication of the first 50 steps. And obviously it's important to make sure that the 50 steps supports the delivery of those two high-level strategies that we work to. So moving on to the strategy itself, it has 50 steps, as I'm sure you all know. And it's been written by all of us. So the people who will be responsible for delivering the steps are the people who have written those steps. And it was really important to us to make sure that in writing the steps, we were challenging ourselves to be ambitious, but putting in things that are also feasible and deliverable over 3 years. And that the people who would be responsible for delivering them were sort of fully bought in and signed up to deliver those actions and make real change, and that the steps cover a wide range of areas. So like the first version of the strategy, we've rooted the strategy in what we know about the things that determine population health outcomes. So that ranges from the quality and availability of public services, so healthcare services, social care, schools, and so on, through to things that are much wider, have a much more wide impact on people's health, such as housing, food, transport, the climate, air quality, and so on. And so basing it in these wide determinants, we have identified those areas where we can intervene locally to have an impact in a whole range of ways. So on health equity, we recognising that health equity is absolutely fundamental to everything we're trying to achieve in Newham, we've embedded health equity as a golden thread throughout the whole strategy, and every step has an equity objective, which is something that we can deliver and we can measure, and those equity objectives will be reported in our annual report. And so we're using that as a way of continuing to push our ambitions around what we can achieve on equity and how we can measure ourselves and use that as a way of doing better year on year. We've also embedded 2 other golden threads throughout. One is climate and the other is inclusive economy. And the reason for that is that these 2 issues are critical to health and well-being, and they're becoming more and more prominent and growing issues, priorities for the council, for the NHS, for the whole of society. And so we've asked every step lead to consider, can they contribute in the delivery of their step to making Newham greener and more climate conscious, and or can they contribute to building a more inclusive economy? So that might include some things like promoting employment, promoting volunteering, training up local people to be peer supporters, making it easier for people to work or to access local amenities and things like that. And the idea is that we create a positive cycle. So in our action to improve health, we also improve climate and the economy, and those things in turn have positive impacts on residents' health over the long term. So for every step, we've set out, in addition to the equity objective, a key performance indicator. and those indicators will be measured annually and reported in an annual report to the board. We've also, for the first time in this strategy, set out an outcomes framework that includes around 20 high-level health outcomes, which will give us a really good picture of the status of health in Newham. Now, these outcomes are not expected to change each year. Some of them will take many years to change, and a lot of them are not directly within our control. But we felt it's really important to have a set of outcomes that we can look at year on year and show how things are changing in Newham. And just to mention as well that we will be publishing shortly our refreshed joint strategic needs assessment, which contains much of the data that underpins the strategy, and it includes the baseline for those KPIs and those outcomes. So that will provide the baseline for them measuring those KPIs and outcomes next year. In terms of implementation, as with the current strategy, no one team or organisation or group in Newham can deliver 50 steps alone. So this is, as it has been so far, very much a partnership, joint effort delivered by a wide range of people from across the council, across the NHS, other local partners and residents themselves. For the first time, we're establishing a 50 steps board, which will have a governance role in overseeing the delivery of the steps, and that board will report to the Health and Wellbeing Board once a year with an annual report. We'll also set up a 50 steps partnership, which will bring together a much wider group of people from across the system, particularly including people from voluntary, community and faith organisations. And that will be a place where we come together to share successes, share challenges, and talk about how we can work together to continue to implement the steps and drive change together. And then finally, coming back to resident involvement, one aspect of that is our changemaker community. So you might remember in the first version of the 50 steps, there was a community of people who we call changemakers, who were doing brilliant things in their areas towards health. Learning from that approach, we've slightly adapted the model of changemakers this time around. In the strategy, there's many changemakers featured who are residents, who are going above and beyond to improve the health of their community. And we will grow this network over time. So the people that you see in the strategy are not the only changemakers. We'll continue to grow our changemakers, including our young changemakers. And we'll celebrate their work every year at an annual status of health event in Newham, where we'll bring the changemakers together, as well as looking at what we've achieved over the past year. So yeah, that's all I wanted to say.
Thank you very much. And thanks for your hard work, but also everybody who's contributed to get into this place. I think it's a very impressive piece of work. Jason, you want to come in? Yeah.
Yeah, so you thanked Claire, and I just want to echo that. It's been an enormous endeavour, this work, by a lot of people, but Claire, thank you, you've marshalled it. But it is an enormous undertaking that involves literally hundreds of people delivering across different parts of the social and the wider determinants of health and wellbeing, and across the council, different parts of the health service, many parts of our voluntary community and faith sectors, and over 3,000 residents. Just worth emphasising that level of engagement and involvement that's gone into it. Our first version, our first 50 steps, which is in its final year, won an award. This is a better strategy. This is new and improved. It's building on the learning. It's taking the principles, but it is more comprehensive, more rigorous, more got a clearer outcomes framework. All that evolving thinking around the change makers and how because the 50 steps are the things that are, as council, as the health service, the things that are directly within our domain of control. But actually, we know to tackle health and wellbeing and tackle health inequalities, that it needs action far beyond our direct reach. And that's, a huge part of what the strategy is about. It's about enabling and catalysing collective action across the place in every school, business, voluntary organisation, etc. So yeah, really excited to be at this point. huge thanks to everyone who's been involved with getting to this point, and looking forward to the launch, the official public launch.
Which is coming up later this month. Yeah. Any further comments? I think it's an impressive piece of work, but I'm slightly biased by thinking this. But I mean, can I just take just an example of on page 75 that it links with, you know, we survey our residents, and this is particular. I'm just picking up on step 10, I think, about make Newham a place where everyone can feel connected. Obviously, Roxanne and Mumtaz and I, we are involved in political processes where we get sometimes the negativity at our surgeries, but also sometimes the good news about things. But also, this is one that I think we all really, since the pandemic, in 2021, 1 in 5 adults in Newham reported feeling lonely always or often, which is over 70,200 residents. And this step takes a targeted and strategic approach to promoting connection and well-being. So if we've got an increasing cohort of elderly people, we want to ensure that loneliness and isolation, sometimes there's references in here to fuel poverty. You know, in a previous existence, I was looking after warm zones, which was an initiative which was under my remit as equalities and social inclusion. It's something that I think is very dear to our heart and values as a local authority, but we're again an enabler with the wellbeing power, hopefully, of facilitating some of this work, but also to make certain that our residents are actually not just accessing good quality services in health, but also around the piece for the wider determinant. So I just picked on that one. And the key performance indicator, because often people say, well, how are you going to measure this? Is the number of people participating in cultural events and activities. And I think Mumtaz should agree that, you know, most of our calendars now are trying to make certain that we do have the celebration of our cultural diversity in a wider sense. Sorry, I'm throwing it over to you because I know that something dear to your heart, but
we are celebrating. We've just celebrated iftar with residents as well as community groups. So, you know, we're getting there. Even perfect, but a lot better than past.
because there is a clear correlation between social isolation and mental health issues, and about whether it's about damp and mold and respiratory, like we said in cabinet yesterday, whether it's about improving our housing stock, but it's about getting people to, for instance, like the Hamara Gar model. I mean, I'm just using that as an example, building on community facilities within supported blocks with groups and having activities. We met the cabinet lead for housing and myself with a group of residents, and they want to, you know, use their spaces for in here. Another change maker is dance, you know, and that's also part of health and well-being. It's also part of making certain we're working together. Sorry, Julie, I'm going to put you on the spot. Your comments on this. I'm going to ask other people than us who are slightly biased by all of it.
I think it's really, I really like about this report is you see your hope will happen. I think that's really important. And I think it also articulates at a strategic level some of the partners and the levers. And I think that's really helpful. So I think at the end of 12 months, you'll be able to see what difference 50 Steps 2.0 will actually make, because that was one of the conversations we'd had, I think, at Health and Wellbeing Board a few meetings ago, is actually how do we know that this has worked? You know, how do we know it's made a difference to residents? And I think for me, the other bit is about how do we take residents on that journey in terms of their own empowerment. So we've talked in Health Watch about taking an asset-based community development approach. And I think that's something that we really need to weave through in this piece of work as well. So it's great that change makers have been identified who are residents, but it's really about how do we pick up some of those other levers in the community, like the social prescribers, the wellbeing ambassadors, the health champions, and all of those as being natural advocates, really. I think that's going to be where it starts to make a difference. And I think the other point that Marie was talking about, about how can we shift potentially some of the resources from acute and emergency responses to potentially preventative, I think is quite an exciting piece of work that lots of boroughs are not really confident about doing. So
includes us.
Yeah.
Well, it's a start of a conversation. And that's really important, I think.
And as if by magic, because I wanted to bring Wax in and he's already put his hand up, so you must have anticipated I was going to pick on you next to have your comments noted. Wax, please.
Yeah, I was just going to get in before I open my fast, actually. Look, this 2.0, this is brilliant, Claire. Jason, team, we were really heavily involved with 1.0. 2.0 really picks up everything that I've heard, like Julie said, in health and wellbeing meetings around key performance indicators, objective and subjective measures and stuff. I think it's fantastic. Often I go to meetings and we talk about transformation and delivery, and then we kind of we fall into that little trap of, oh no, where's the resource for this? Where's the capacity for this, etc., and stuff like that. This is so refreshing that, my mind didn't slip to thinking about money. This is really, really achievable. This is all about change makers, and I love the change to less of our clinicians and our sort of workforce at the local authority, and more about the people, and actually encourage them to take responsibility and empower them to take responsibility for their health and move on. So really, really great to see this, and absolutely think that we can deliver as a health and wellbeing board against everything that's written and more.
Thanks very much for that. Claire, I'll give you the last word.
Yeah, thanks very much.
You're just saying thanks very much. Okay, thank you. And thanks for all the partners' contributions as well. And we will come back to this as outlined with, and have the reviews and, the review of progress against all of that. But thanks again. Now we need
to formally approve it, don't we?
Sorry, good thinking. Jonathan, can you get me some water?
Sure.
Can we just pause? Now I have a chair script as well, Christy, just
Got a lot to think.
we've got to formally agree this, because it's owned by this board. Thanks very much. So the recommendation on page 40 of the pack is that the Health and Wellbeing Board is asked to approve the final strategy, 50 steps to a healthier Newham for the years 2024 to 2027. For members of the board physically present, may I see by show of hands, is that agreed? I think that's unanimous. Thanks very much. And that's reassuring, Claire, no doubt. Thanks very much. Now, thank you. The last item, if I'm not correct, apart from the date of the next meeting, is the strategic direction. We've talked a lot about this word strategic tonight, but Jonathan, over to you in terms of a report about the content planning for this board. Thank you.
Thank you, Chair. I think obviously we've had, quite many varied conversations tonight on a range of important topics. Some of those very much kind of, thinking back to the population planning, some really important long-term strategic thinking that the board really needs to have oversight and influence over. And this really is just, I suppose, a very initial discussion paper just to kind of set a little bit of context and thinking around, I think, a kind of a slightly wider piece of work that the Mayor is very much keen on putting in place to think through the kind of the purpose and those sort of real kind of key issues where the board can deliver its value and be, you know, greatest use in helping to shape and assure the health and care system. So I think all I'll do is just really highlight, I think, looking back to some of the original thinking around purpose of health and wellbeing boards, which have of course been around for a good 10 years now. So just to reflect on some of the key aims, so around understanding the local population and its health and care needs. So we've talked quite a bit around that, some of those intricacies in Newham tonight. So how those needs are met by the system, you know, 50 Steps gives a fantastic example of that. What outcomes our system achieves for our residents locally, and how we're impacting on inequality and inequity. So there's a big kind of surveillance piece there, the health status of our system, thinking about the designer strategies and how those then address those issues that are identified. Of course, the promotion of integrated and more close working across the system through the representation at the board of all those kind of key partners. The forum where we have that discussion of the voice of residents being represented, our elected members, officers, so how all those views need to come together to help shape the system, and of course a reflection of the effectiveness of our prevention work. We had a great example around the educational needs and the OT service around that earlier on today. So I think kind of those, just highlighting those were the sort of original aims that were set out, and I think those remain very much pertinent for the value of the boards and our board.
You just check.
Well, that's Christine, was it?
That's Christine, yeah. We just pause there, Josh. You carry on, sorry. Just, I think it's always good to check on these things.
So the paper just kind of sets out a handful of principles that we might want to think about around agenda items in relation to those kind of the key function of the board. And then just sets out some of the standing items and I suppose kind of updates around some of the statutory functions of the board, and outline some of the frequency that some of those things take place. So we have particularly around our sort of surveillance and health status, our JSNA and the P&A pharmaceutical needs assessment refresh, that those need to take place every 3 years, and we have a children's JSNA and an adult's JSNA. I don't know if we mentioned, just as part of the 50 Steps refresh, we're about to also publish the JSNA backing data very shortly around that. And the children's JSNA refresh is just in its early stages at the minute, for example. So we have those very specific strategic assessments of need, and I think as Claire highlighted around looking at impacts of 50 Steps, doing some sort of surveillance around some of those key health status metrics. Something around the reflecting on our inequalities progress and the work of our in the equity board. The 50 Steps report, progress updates and refresh, and potentially thinking, do we want to consider some of those priority area deep dives over the lifetime cycle of the 50 Steps. Obviously, there's a duty around commissioning oversight and some of those key decisions, having a sort of proactive area in shaping that strategy. Then the safeguarding partnerships, which we call annually children's and adults. And then obviously at the minute we have 3 standing item agendas as well on some of those sort of three particular areas of concern and interest, and particularly with additional sort of meaning and impact for our new population. So just a few, sort of principles and thoughts setting out some of those key topics that the board currently considers. And as I said, I think this is, I think, just really for initial discussion and to be brought back as, I think, a more substantive item or discussion that the Mayor wants to chair at a later date.
Yeah, thank you. Jason.
Great, thanks, Jonathan. I think it's really helpful, and I think we're overdue a bit of this kind of reflection. I guess sharing a couple of things. So, firstly, I spoke to the Mayor, the Chair, and she's keen to have potentially some kind of time outside of a health and wellbeing board to have a proper conversation collectively about this. Maybe a bit of a kind of a mini away day, like a few hours as board members to really reflect. And I think it's probably we're due that. I think it's worth, reflecting. We've got some gaps in terms of our membership that want filling. We've got some parts of our system that are a bit less engaged than they have been at times. So I think a really kind of conversation collectively as a system about what we want to really use this forum for, and what the kind of ambitions are, and how it can be. And I think health and wellbeing state boards across all places that I'm aware of, talking to colleagues, it's not a straightforward, it's not a decision-making body. It's about, how you bring senior partners together to drive collective ambition across a place, across a system. So I think there's a lot of useful stuff in here. I think, the idea of having deep dives, breaking up 50 steps into deep dives, so the board has that real and bringing people in for those items who are part of delivery. The key parts of the leadership who are having more people coming into discussions in the board to present items and be part of those collective conversations, and what's going well and where do we need to push harder as a system. I think that would be useful. So a really helpful start.
Yeah, I agree, and I think it's been very helpful that we're starting this discussion now. Obviously, we're at the tail end, and the next item is just to date the next meeting, because we're in a municipal cycle which ends tonight, as it were, in this April meeting. We have our AGM as a council, and that's reflected across the piece. But I think it is important. Just 2 things that I've had in discussion with the Mayor and Jason. There's not just that a chance for reflection and sort of action planning, forward planning at an away day or an away afternoon, or just something away from a formal structured board, but also that of bringing people in to speak to specific items. I think that's what you were saying, Jason, around how partners can get more involved just on the work programme side. Any other comments from anybody else at this stage? Because it's sorry, Marie. Yeah.
I was just going to add to your comment about bringing people in. I think perhaps something about people who'd like to bring things as well. Obviously want it to align with 50 steps. People are keen to sort of showcase or sort of really show impact as well. I think that's quite powerful, isn't it? And I suppose following on from your comment, Jason, about membership and have we quite got that right? Have there been changes? I mean, we've obviously experienced a lot of change from an ICB perspective. Have we got the right people who are best placed to come along and this feels that sort of partnership and quite helpful.
I had a discussion with the clerk earlier on, and we've still, got on a to be confirmed a representative of Newham schools, for instance, and to be confirmed representatives of the Newham voluntary community and faith sectors. Now, it may not just be about a constitution and, quorum and, who's representing who, but it is about trying to make certain that the right people are in the room, not just on a regular basis, but also for specific items. Jason, did you have
I think just on that one, I think we should commit to, quite quickly doing what we need to do to fill those gaps. I think we need to have conversations with system partners about whether they feel, they're the right person or who in their organisation, speaking to your point, Marie, but making sure that the key organisations are well represented, but then also those sector roles need to do whatever is the appropriate process to get those filled, the schools and the VCS ones.
Yep.
We can pick that up with VCS, we can take forward, and we'll pick it up with the children's services around the schools role. I'd give it to Emma, but I think she probably for me to pass on to someone else.
There'll be somebody else to pick up that, yeah. But thanks very much for Jonathan for that. I think it's started a good interesting discussion on how we might move this forward. So it's recommended that a systematic and planned approach, it's the recommendation on page 146 of your pack, recommended that a systematic and planned approach is taken to the forward plan and more closely aligns to the aims and roles of the Health and Wellbeing Board. Suggested that the forward plan takes account of the following for Health and Wellbeing Board members to suggest further areas of collaboration. So it's open to you, obviously, to feed in before we even go to the away day stage. But I think you'll be pushing an open door, partners, and anybody who can wax and anybody else experiences and coming forward. And I'm looking to somebody who might not be put off by joining us in that discussion as well. Thanks very much for joining. Now, the only other thing to say, is that agreed? I didn't check that everybody had agreed on that one. The date of the next meeting is not known for certain. We have to say this every year. This is part of this municipal cycle thing. It has to be ratified at the annual council meeting. However, it is proposed, because I think we can, we can't hold everything up in the air, for the 10th of July. Is that still Christina from Dem Services? Is that agreed as a date, 10th of July? Yeah. Okay, thanks very much. So we've concluded the formal business of the agenda.